let's move along here to what we might say the proportion of people getting to goal also is very important. It's one thing to say, well, I'm improving it, but do you actually get to goal? And I see by your studies there that you say a significantly greater proportion of your intensive lifestyle participants get there at years 1, 2, and 3, and those that get for for LDL didn't differ too much, but still the patients did well in both groups. Tell us just a little bit more about the lipids, if you would, the LDL.
Well, you described it very well. I mean, for both hemoglobin A1C and blood pressure, we had more people achieve the goals in the intensive lifestyle intervention arm across all the years of the trial. For LDL cholesterol, though, there were no differences in the percent of people achieving the goal at years 1, 2, or 3, and by year 4, somewhat more in the DSE group, the Diabetes Support Education group, was achieving the goal, again, because of their greater use of lipid-lowering medications.
Right. Right, and I put the slide up there right now so we can see those proportions of patients who were at goal through the studies in the two different wings. And as you could see, this making the easiest one for hemoglobin A1C, we can see there's a clear statistic advantage of being in that intensive lifestyle group. So that was very important. So conclusions, we're going to talk about a few things, but maybe we could come up with what looked like the conclusions from the study. Then you and I could talk a little bit about and maybe answer some of the questions that have come across. So the conclusions you would say would be...
You want me to start with that?
Why don't you do that, yes.
Okay, fine. Well, first of all, I think it was very, very exciting for us to be able to show that we can produce sustained weight losses, and that those sustained weight losses will lead to long-term improvements in cardiovascular fitness and in these cardiovascular disease risk factors. I think there was a lot of belief when we started this study that nobody would succeed at weight loss, that if we could produce initial weight loss, we wouldn't be able to keep it off, and that probably what would happen is people would all regain their weight and their blood pressure, lipids, et cetera, would all come back to where they started. Well, that has not been true. We actually have been much, much more successful. We've been able to get people to lose weight and keep it off. We've been able to produce long-term improvements in fitness and long-term improvements in all of the cardiovascular disease risk factors, and those have been associated with the participation in the intensive lifestyle intervention.
Excellent. Now I'm going to start asking a few questions. We've got some online, and I want to emphasize to anybody who's listening online live right now, put those questions in, and I'll pass them along to Dr. Wing. But we've got one here right away, and it is from someone who says, first of all, I wish all the best to the Look Ahead Trials Medical Group. They did and are doing a very hard, unpleasant, but incredibly necessary job. And the person wants to ask what you thought was the most difficult problem that you faced during the 4 years. What was the hardest thing to do with your patients in the lifestyle intervention group?
Well, I think the hardest thing is to keep people actively involved in working on their weight. It's easy to do it for like 12 weeks, but then after a while, people kind of want to drift back to their initial habits. And so one of the things we've had to do is, as we mentioned before, continue to see these patients frequently. We've had to develop refresher courses and campaigns to sort of reignite the interest. And I think that's really the key question, the key issue is keeping people involved and working on this problem long term.
Right. I'm very interested in the changes you saw in fitness. How to tell us a little bit more about that? How do these people, was it because of their walking? What was going on, or because they were losing weight?
Well, we have been able to, so the question you're raising is a good one. Are the improvements in fitness due to the weight loss or to the physical activity? Yes. And we've been able to show that they are not due only to the weight loss. They're due in part to the weight loss, but they are due to the changes also in physical activity. And again, I think this is a very important, simple message for the clinicians listening to this to realize we were not putting these people on very hard physical activity regimens. What we were saying to people was gradually increase the amount of walking you do. Try to get to, we emphasize walking in what we would call 10-minute bouts. So take a 10-minute walk at breakfast, after breakfast. Eat your lunch during your lunch hour, and then take a 10-minute walk at lunch. Maybe get your spouse and take a 10-minute walk before or after dinner. In that way, just from what I described, you've already accumulated 30 minutes of physical activity.
Right. I think that's very important. I was very impressed by the matter of fact. When I got done with the study, I was most impressed by the conditioning the patients have, because I think that's really critical to staying fit, getting exercise, walking, something that's not too difficult at all. We have another question here. This one might be a little bit more difficult to answer. Maybe I'll do some answering to it. The results from the LDL lowering in the ILI group, does that mean that type 2 diabetic patients may go without statins? That may be more of a medical one I might want to answer, and that's not answered in the studies. I think that's the best thing we could say. We can't tell this. That's the result might be like that, or you have some groups there that aren't getting. They're getting to go without statins, but whether that's better or worse for the patient really isn't answered directly.
That's correct. We cannot compare the two. We can't compare if you lowered your LDL from statins versus weight loss, but I can suggest to you that there's no question that statins have a stronger impact on LDL cholesterol than weight does. Mm-hmm. We are showing that the modest weight losses that we produce are really not having a very dramatic impact on LDL cholesterol. They have a better impact on everything else but LDL cholesterol, whereas statins clearly have a strong impact on LDL cholesterol. They do work. Right,
and I think for diabetics, I think at this point probably the current wisdom is that statins are very influential, very important for most diabetics. It would probably be the exception one would have to look. We have another question here. Did your exercise regimen include resistance exercise, and if not, why not?
We introduced our participants to resistance exercise. We told them about it. We actually provided them with resistance bands and encouraged them to do some resistance training, because there are several studies that suggest that the combination of aerobic and resistance is the best combination. It is harder with older, overweight individuals to get them started on resistance training. I think we had more success with getting them started on the aerobic exercise, and we felt that was the single most important component of our program.
Okay. Now let me ask you a question that's I've been thinking about for the past week or so. It's a simple one. People like to be successful. So has there been anything you have found in your studies that you could talk to us about predictors of success? Are there things that you could say when a patient walks in, wow, if I work with you, I'm bound to be successful?
Actually, that's $1 million question, and the answer is we don't know. We know when we start a program that some people are going to do extremely well and some people are not going to be successful, and we really can't yet determine who those people are going to be. It's one of the dilemmas in the field. One of the interesting things, though, in Look Ahead, by following these people long term, you realize that you should never, ever give up on a patient, because most of our people were very successful at the beginning, but not all. And some of the people who did not succeed at the beginning, did not lose weight, did not get involved with physical activity, a year or 2 or 3 years later would come back and say, now I'm ready. And they would be very successful. And I think that shows you why it's hard to predict, because it's not only the person, but it's also the timing, when in that person's life. And as I say, don't give up on patients, because they often will re-engage at a later time and be very successful.
Let me ask a variation of that same question, if I could, a follow-up. Did you find any predictors or maybe why did people not continue with their weight loss? Because I know you got about 10% weight loss, but it eventually, at the end of 4 years, I think got down to around 4% weight loss. Why did people gain the weight? Was it that their compliance or adherence to a diet was worse, or exercise was worse, or what happened? Why did they regain the weight?
We're still looking at that question, but other studies have all suggested that it is due to problems with long-term compliance. Mm-hmm. There also are some physiological variables that make it harder to maintain your weight loss long-term, but in large part, the problem is one of getting people to adhere to this new eating and exercise regimen.
But you have shown over 4 years, though, it is successful.
We have shown, as I say, that we are able to produce a 5% weight loss even through 4 years, which is actually some of the best weight losses in the literature. And we are publishing some papers now looking at the predictors, let me take that word. It's not really the predictors. It's the behavioral variables that are associated with that success. And I can tell you in simplest fashion, those people who are most successful at both 1 year and 4 year are those people who come to the most meetings, mm-hmm. who do the highest amount of physical activity, who use the most liquid meal replacement products, basically who are most adherent to the program. So those people who do what we tell them to.
Actually, it actually works.
Exactly.
But I think that's one of the things you could tell a patient, too, is that your adherence to this program is going to be how successful it is. And I think that's very important for people to know.
That's a very good way to put it.
Yeah, you're going to be the one to be successful with this. One of the other things maybe just a bit more complicated to talk about is it worth it? I mean, let's admit it, you started out by saying this is all about cardiovascular disease, and you haven't talked about it yet. Is it worth it? Tell us about that.
Well, keep in mind that we will be following these patients because to us, the bottom line really is, do these people live longer?
Yes.
Have we reduced cardiovascular morbidity and mortality? Do they live longer and have fewer heart attacks, et cetera? Okay. We don't yet know the answer, but we are continuing to follow these patients. But you raised the question, you said, is it worth it? Well, one of the major goals in our study is to do a cost-effectiveness analysis. And as you pointed out, as we went through the slides, individuals in intensive lifestyle intervention are achieving these goals far more successfully, but needing less medication to do that. I know of no pill that can work on blood sugar, blood pressure, HDL cholesterol, fitness, all at the same time. Lifestyle is such a pill.
It is.
It really can help with all of these cardiovascular disease risk factors.
Obviously, in our society right now, this is something we're all being challenged, diabetics and non-diabetics. A question has just rolled in, which I think is an important one. In your intensive lifestyle group, how important was family support? Did you involve the family with your interactions?
We did. In our intensive lifestyle intervention, we would see the patients in group meetings at the very beginning, 3 times a month, 3 weeks, and then the 4th time, they would come in individually. And often for those individual sessions, they would also bring their spouse. And we would talk with their spouse and the participant about how to make changes in the home environment, how to involve others in the family. And I think that is an important component of the program. The participant needs to be viewed as a member of a family, and the changes need to be made for the family as a whole.
Right. I think that's one of the most difficult things talking to my patients, and I'm sure all clinicians are the same way. They'll talk to somebody who wants to lose weight, and they say, yeah, but when I sit down and everybody's eating mashed potatoes and gravy, and I'm sitting there with lettuce, it's very difficult. It's a family affair to get these things across when it comes to adherence to a diet and also to exercise. It's nice to go out and walk with someone if you get a chance. You get a chance to talk at the day's events, and the walking seems to go so much easier if you're just talking to someone, walking around the block and discussing what's going on during the day.
We've also shown in another paper that there's what we call a ripple effect. In the intensive lifestyle intervention, not only did the participants lose weight, but their spouses lost weight.
Isn't that interesting?
And, clearly that's because, as you said, they're eating together healthier, they're exercising together, and we showed that the spouses are actually losing weight too.
Oh, that's something. Here in New Orleans, we'd call that lagniappe, which means something you like that you didn't expect, a little side effect.
Exactly.
So that's great lagniappe, that everybody gets a little bit healthier by intensive lifestyle instruction. One last thing I'd kind of like to ask you about, and maybe I'll be answering the question myself for this more clinical, is that although we haven't shown in the slides here the data at the 4-year point, and I'd like to point out to anybody, please go to the original article. There's beautiful graphs in there about the point where what the hemoglobin A1C was at each of the different 1-year, 2-year, 3-year, and 4-year. At the end of 4 years, there were differences, but they were slight. And somebody might say, well, gee, at the end of 4 years, since there wasn't any difference, was it all worth it? Or because there wasn't much of a difference, I could achieve the same thing with medicines as you could achieve with intensive lifestyle intervention. So is it worth all of the exercise?